Welcome back to part 2 of a conversation with Dr. Dipak Kulkarni. If you are yet to listen to part 1, go right now to check out why acne happens. Now, let's talk about acne, lifestyle, and hormones. I have also seen a lot of women who are suffering from PCOS but amazing skin they have.
See, again the same thing.
Genetic.
Acne is multifactorial.
Right.
So, in that particular patient, somehow those hormones, the genetic nature of the person, the stress, all those factors together, the sum total is such that the patient is not getting acne.
Right.
Probably the familial history is in favor of the patient. Something of that sort must have happened.
Right.
In medicine, there is nothing 100% or there is nothing 0%.
Okay.
There's only I always give an example of a mobile use while driving.
Right.
So when you are using mobile while driving, it is bad. But that does not mean that next second you are going to have an accident.
Right.
And just to prevent accident, if you keep mobile at home, it doesn't mean that you are not going to have an accident.
Right.
But keeping all the other things constant, if you are using mobile while driving, the chance of having an accident increases profoundly.
Right.
And that is one thing which is in our hand. That's why we always promote not to use mobile during driving.
Right.
So you can't single out one factor. All these factors are together, and acne is a multifactorial disease.
Right.
And hormones, cosmetics, familial tendency, all of them come together. Diet.
Right. One more thing you said is before a woman start her monthly cycle, she also get acne, and it depends on whether it's just like normal acne or it has anything to do with hormonal imbalance. So how do we differentiate between that?
See, depends on the severity. If the acne as such are not very severe, then I will not give much importance, because I will say that many girls get premenstrual flare.
Right.
But if I get resistant acne, more severe acne, post-adolescent or the adult acne, then I will definitely give an importance.
Right.
Another thing which we are finding out, that we are having the menarche much earlier. That means onset of the
Right.
periods much earlier. Now it's not very uncommon to see a 8-year-old or a 10-year-old girl having the first period.
Right.
And especially in such girls who get periods early, and especially if they are getting pimples even before those periods, these are the candidates who get much severe and persistent acne and PCOS in the future.
Okay.
So I give a lot of importance to small girls at the age of 8 or 10 who are getting. So acne age span is increasing on both sides. We are getting adult acne also, and because of early menarche, we are getting small kids having acne.
Right.
So small kids getting acne, even if they are mild at that time, I warn the parents, and especially if there is a familial tendency, to persist with the treatment. At least some ointment, some cream, some gel of with my advice should be continued for a long period of time.
Right. Okay. So let's move back to diet. So everywhere on the internet we see people recommending drink a lot of water. How big of an impact it has on acne?
It is not scientifically proven.
Okay.
But see, if you are healthy, then obviously it is better, and a healthy body will get lesser amount of acne.
Right.
So, if somebody asks, should I drink more amount of water, I would obviously say yes. But just by drinking water, you cannot wash off acne.
Right.
So, it's not that easy. So, just by drinking water, or otherwise, as I told you, the parents say that just by washing your face 3-4 times a day, you can't just wash off acne.
Right.
But it's a good habit. Having adequate amount of fluids every day is a good habit. And if somebody asks, I will obviously say yes. But if that person has a misconception that that is the only thing which is going to clear the acne,
Yeah.
I will have to clear the myth.
Right.
Yes.
So I would just like to ask, what is the simplest skincare routine someone with acne can have?
Now, it depends on the patients, because even if the person has got acne, that does not necessarily mean the patient has got very, very oily skin.
Right.
So depends on the patient's skin.
Hmm.
For example, if the patient is having very oily skin, then the patient should go for generally foaming and salicylic acid containing face washes, and at bedtime should use a niacinamide containing cream,
Hmm. Right.
and some sunscreen. Sunscreen should be obviously of a SPF more than 30, and should be a vanishing kind of a sunscreen, not matte finish sunscreen, which does not give oiliness on the skin.
Okay.
So these three routines he can use. Use use a face wash which is containing this foaming face wash twice in a day, or even if there is too much oiliness, thrice in a day. Nothing else is required, and keep the cosmetics to the minimum. Use it only when there is a necessity.
Right.
Unless there is a professional compulsion, should not use on a daily basis. So that's the way. And whenever you are going out, try to use a cap which protects your skin.
Right.
So even unnecessary use of mask also may increase acne. So mask is a good thing whenever you are having some infection. But all of us have developed the habit of using mask whenever we are going out. But if you have a acne prone skin, use it to the moderation.
Hmm. Right.
So this is the common care the oily skin should take. But on the other hand, there are other people who get acne but have sensitive skin.
Right.
Such patients should use, such adolescents should use gentle cleansers. Again, sunscreen of the similar kind, and should generally not use anything at night, but maybe they can just use a very very weak salicylic acid preparation at night.
Right.
But I would say that if they have a slightly severe acne and sensitive skin, it is better to have a medical opinion.
Right. Right. When it's come to acne, I have seen a lot of people having acne on their body. So, what are the main causes of that?
See, acne is caused in the sebaceous gland.
Okay.
So sebaceous gland, or the oil producing gland, is the origin from where acne come.
Right.
They are largest and more commonly seen on face. That's why we see acne on face.
Right.
But they are also there on the shoulders, back, chest, arms, and even on the buttocks. And that's why the person who is more prone to get it may get it on these areas also.
Okay.
Sometimes it is associated with facial acne. Sometimes you can get standalone acne only on the back.
Right.
Sometimes perspiration, tight clothing, scratching, all those things may be contributory to the presence of truncal acne.
Mm-hmm.
Many times there is another misconception that the dandruff, the particles of dandruff fall on the back,
Right.
and
Yeah.
that's why people get truncal acne, which is not so. It's just because dandruff is a close association of acne, and you will always find a person who is having severe acne also has got severe dandruff.
Dandruff. Right.
But dandruff is basically generally caused by a sort of a reaction to a fungus, which is called as Pityrosporum ovale in technical language.
Okay.
And acne is caused by another bacterium, which is called as Cutibacterium acnes. So basically, acne is, it is again not a single cause, but acne is profoundly a bacterial disease, if at all, and dandruff is a fungal disease. If
Fungal
you
disease, right.
just make it too simplified,
Right.
it's too much of a simplification. But if you simplify it, so dandruff does not cause acne, but you will many times find a person who is having severe dandruff may have either facial or truncal acne.
Right. Okay.
And we can use slightly different drugs for the truncal acne, because of course on face you have to be very very careful about the irritation of the products. On back, on one side you have to have large quantity to be applied.
Right.
On the other side you are not so much bothered about the irritation.
Right.
So the products which are used for the trunk, chest, arms is slightly different.
Okay. Sir, since we were kids, we have heard a lot about home remedies or natural things. So, do you think, do they actually work for acne? Should people avoid them? Can you tell us a little bit about that?
No, I won't say the people should avoid them. Only thing is that we have to understand that we have to be very vigilant when we are doing home remedies.
Right.
One very good home remedy which I tell many patients is use of, though on diet we avoid dairy products, but curds, the lactic acid in the curds
Right.
is an excellent treatment for pigmentation caused by acne.
Right.
So that can be used by patients. So if you are, you had acne, little bit of pigmentation has taken place. So later on, you can use curds at night,
Okay.
which can, of course, we'll have to see whether the oily part of the curds does not cause increase in acne. That
I
you
was
have to
gonna
be,
ask you that.
yeah.
Yeah.
But if you have taken away the cream, this should not happen. So the lactic acid part of the curds can definitely treat a part. It's a home remedy. You don't expect that magical response
Right.
what you can get out of some procedures done by the dermatologist, but it's good as a home remedy.
Right.
So many such home remedies are available, and your grandfathers and grandmothers may
Yeah.
tell you about them.
Yeah.
So see, as the home remedies have remained for centuries together, they definitely have some role to play. Only thing is that we do not have adequate scientific information about them.
Right. Right. Right.
So, from a scientific platform, it is difficult to promote as well as to, deny them. So, both ways I won't like to take a stand.
Right.
But only thing is that one has to be little particular that whether that home remedy is really working or
Right.
is causing any kind of an irritation or comedogenicity. He has to be vigilant about it.
Right.
So, because when you are using home remedy, what happens that in our society, somebody just comes and from some hearsay will tell you about some treatment.
Right.
That person may have heard that use this, he will just tell you. In home remedy, there is one thing which is happening, which is a very big thing. Good that you raise this point. Not exactly a home remedy, but people go and buy steroid products.
Okay.
It's a very, very common thing in India.
Okay.
And the steroid products initially give a lot of glow because they cause slight thinning of the skin.
Right.
And because of that, the people are amazed with the kind of skin they have got.
Mm-hmm.
But they do not realize that if they keep using these steroid products for a long time, then they will get severe acne. And these pimples, which are caused by steroids, which are called as monomorphic acne,
Okay.
are very, very resistant to treatment. So that's why, and they do not come down. Even if you start treatment, there is a plateau. For some time, that pimples just don't respond. They
Right.
just don't show even a iota of response for some
Hmm.
time, and then slowly they come down.
Right.
So, home remedies which are known to us for generations is okay. At least they are being used for generations, and that's why there is safety at least. Whether efficacy is there or not, we'll keep it aside. But
Right.
at least they may be reasonably safe.
Right.
But when it comes to home remedies like this,
Mm-hmm.
like going to a chemist shop and buying some steroid product, is worse.
Right.
And unfortunately, many of these products are very, very commonly used. Chemists also sell them, people take them on some friend's advice. Even there are videos on YouTube promoting steroid creams for treatment of pimples and pimple related scars and pigmentation,
Right.
which is very, very risky.
Mm-hmm.
And that too, I must tell to the audience that everything which is present on social media is not authenticated. A doctor, whenever he treats you, firstly, is authorized to do so. He has got a lot of experience. I always tell the people that if you compare with any other branch, a person has to study for 9 continuous years beyond 12th standard to become a skin specialist or
Right.
any other medical postgraduate for that matter, even if there is no gap in between. Do you compare that knowledge of a medical professional with somebody, just out of experience, is putting anything on YouTube or on
Right.
any other social media?
Right.
So we have to take it with a pinch of salt or even almost a handful of salt.
Right.
So, it's that is a problem which is coming. I was really startled when I saw videos which promote steroid creams for
Steroids.
acne on YouTube. If somebody
Mm-hmm.
would see them, obviously he will use it.
Right.
So, first thing has to be understood by a commoner is that YouTube is not a reference point. Anybody can come and talk anything in front of YouTube and there is no check. Unless it is really, I mean, you can say a content which is obnoxious, it is not removed by the social media companies.
Right.
So these opinions do remain there and people use them and have a problem in their skin.
Right. So I really like what you said. Um, because skincare is very popular nowadays. Everywhere you go, like on social media, you just see like people talking about the skincare. Everyone want amazing skin, but there is still this hesitation to actually go and visit a dermat. Why do you think that happens?
So many reasons are there. Number one, uh, the social media advice is available just at your on
Right.
your phone or your personal device. For dermatologist, you have to take the appointment, go there, wait for the your turn, because the number of dermatologists all over India are just 16 to 18,000, something in that range. So you won't find them at every nook and corner.
Right.
So obviously, people do not know whom to go. There is inadequate awareness also. So who is the authentic dermatologist? There is a inadequate awareness, and that's why people do not find. And then in India again, there is a tendency to go to the best and the most experienced persons.
Right.
Now in my clinic also, apart from me, there are 10 other qualified dermatologists working.
Hmm.
But a person who would come initially will like to go to the most senior person.
Right.
So that is actually not necessary. You have to see the qualification of the person, and any qualified dermatologist is competent enough to treat pimples
Right.
in a very satisfying way for the patients. So it is better to see for the qualification. Of course, experience matters, I don't say that, but basic qualification of a authentic dermatologist is very, very important.
Right. There is one more thing, Accutane. I've heard a lot about it. So can
Yes.
you tell us a little bit about it?
Yeah, Accutane is the first brand name of isotretinoin. Isotretinoin is a drug which is a vitamin A derivative. So it's also called as a retinoid.
Okay.
It is extremely effective in acne.
Okay.
The drug is capable of treating the most severe forms of acne, and it is useful in reducing the various complications, the pigmentation, the scarring of acne.
Hmm.
Only thing is that the drug also has got many untoward effects,
Okay.
and that's why the drug is not supposed to be used by patients themselves, and has to be used with a great caution, and should be used only by dermatologists and those people who have got experience in it.
Right.
So basically, the drug is very, very bad if it is used during pregnancy.
Okay.
So it is so called teratogenic. So it can have bad effects on the fetus.
Right.
So that's why we have to see to it that the person who is using it is either unmarried,
Mm-hmm.
stops the drug at least 3 months or 6 months before marriage,
Mm-hmm.
and if at all the drug is being used during the, I mean, marital and the childbearing age group, at that time adequate care, what we call as a double contraception. The female also has to use a contraceptive, and the husband also has to use a male contraceptive. So
Okay.
that much care ideally
Mm-hmm.
should be taken.
Right.
So utmost care should be taken that there is no pregnancy during the treatment of isotretinoin when it is going on.
Okay.
Simultaneously, there are certain antibiotics like tetracycline, doxycycline, which are used in pimples by doctors. The tetracycline group of antibiotics should not be given along with isotretinoin.
Okay. Right.
Thirdly, isotretinoin also causes quite bit of dryness
Hmm.
on lips, on face, or sometimes in eyes also.
Right.
So that is also a problem. So isotretinoin is a wonder drug, but in the hands of experienced people and dermatologists.
Right.
So on one side, whenever doctors advise it, it should be taken under doctor supervision, should be taken only during the time when the doctor advises you to take it. Whenever doctors want to stop it, it should be stopped, and the it should not be loosely used or given to the friend. I got the response with this drug, and you also use it.
Right.
That is a very bad thing. That commonly happens in India, because what happens that the you can say, sorry to say, but unfortunately the I mean, anybody can go to any chemist, and the rules there are not strictly followed, and sometimes even if the there is no prescription, these drugs are available,
Right.
unfortunately.
Right.
So because of that, the drugs are given and the patients purchases it and may have a problem.
Right.
In my clinic, we take a written consent.
Hmm.
We basically take care that the patient is either unmarried or having adequate contraceptive precautions.
Hmm.
But despite this, anybody above 18, a female above 18, if I have to give isotretinoin, I take a written consent so the patient understands well to take adequate care.
Right.
So all these things have to be understood. So it's a wonder drug. Only thing is that it has to be used in expert hands.
Right. So, what about retinols? Like, are those safe to use?
See, re- retinoids is a big group,
Right.
out of which retinol, as you are saying, is a product which is used in various cosmeceuticals and has a very weak action. As
Okay.
such, it's just topical, that means only used locally on the skin, and has a very weak action. So, prolonged use of retinol can be good for acne, can be an anti-aging effect. So that is okay. But in the treatment of acne, what we use is either tretinoin or adapalene, which are retinoids,
Hmm.
which are slightly stronger.
Right.
They work nicely for acne, but again you have to consider the possibility of irritation.
Right.
So again, all these drugs have to be used by a specialist,
Right.
especially isotretinoin.
Hmm. Hmm.
So it
Okay.
should not be used loosely, should be used whenever, if you can treat the patient with simpler drugs, it is always better. And but I would say that, and especially there is a trend nowadays of using low dose isotretinoin, which is
Okay.
in Indian population really working very well.
Okay.
So we use, the doses which are much lower than what is given in the books, which also give very good results and reduces side effects. Only thing is that the relapse rate is slightly higher than actual doses.
Okay. So, sir, if you have to leave our audience with one message, what would that be?
Friends, basically, acne is an important disease. If it is not taken care of, it can lead to very severe personal, lack of image and lack of confidence, and may have lasting effect on the morale of the person. So it should not be taken lightly, but various measures are available for its treatment. A dermatologist is a real specialist for this. There are dermatologists available in each and every town. We can take their opinion. Take the social media content with a pinch of salt, because it is not an authentic content. And you have to be particular about diet and maintain your health in general. So acne is a part of a general health, and
Right.
if you have a healthy body, if you exercise regularly, if you have a proper balanced diet, avoid high glycemic foods, which is good for anyway for your health,
Right.
and your skin will also improve and be glowing, like a real nice, you can say, a celebrity.
Right.
And another thing which need to be discussed is the various procedures are done in dermatologist clinics
Right.
for the improvement of active acne, the acne related pigmentation, as well as the acne scars.
Right.
That is a important factor in which dermatology comes in picture, and what is called as interventional dermatology or procedural dermatology comes in picture. For active acne, we have got various treatments like chemical peels. There is something called as cryo slush, which uses carbon dioxide ice. There are certain instruments like IPL, intense pulse light, not our cricket IPL, intense pulse
Right.
light. Then there is a, specialized blue light, which is called as low level light therapy. And there is also a 675 nanometer wavelength laser now available. All of them work on active acne or acne related redness on the face.
Mm-hmm. Okay.
Then for acne pigmentation, again chemical peels and IPL can work, but there is a laser called as Q switch Nd:YAG laser which can be used. All these lasers are available with most of the dermatologists.
Right.
And carbon dioxide laser is a boon for patients who are having acne scars. Acne scar was such a thing when I was a student or just in the early part of my practice. We used to say, now your acne lesions have gone. Now scars we can't do anything. I mean, scars you have to
Right.
bear with. That was the response we used to have.
Mm-hmm.
But now with modern lasers, the carbon dioxide lasers and various dermatosurgical facilities which are coming up in dermatology, and they are now formally trained dermatologists who are doing dermatosurgery. They do things like the subcision and scar excision and so many other procedures. You can really get amazing results in
Right.
acne scars. So people having acne scars should not be demotivated.
Mm-hmm.
Even the worst kind of acne scars can be improved. I won't say they will be eliminated completely. You
Right.
can't have a mirror like skin once you have acne scars, but still there is a great improvement which can be expected out of these procedural treatments.
Right.
So a good blend of the diet, personal hygiene, mental stability,
Right.
dermatological, medical, oral, and the topical treatment, and all these procedures can
Procedures.
really create wonders.
Right.
If a person can have multiple cosmetics to be applied every day, now many of these, young adolescent kids and boys and girls use lot of cosmetics on a daily basis. They are not tired of using that. If you
Hmm.
can do all of that, you can as well take proper acne treatment
Right.
from a specialist and get a glowing skin.
Hmm.
That's my message.
Right. Nice. So, sir, thank you so much. To be honest, it was one of the best episodes that we had.
Yeah.
I loved everything that you have said because I think somewhere I related with everything that you
Yes.
shared. I had a lot of questions about that because when I was going through acne, I didn't understand a lot of things. Now that I do, but still hearing from you is a completely different story.
Yeah. I must give compliments to the dermatologist who has treated you at that time
Yeah.
because almost all the acne seem to have
Yes.
resolved.
Yes.
Very good.
Yes. That's all we have for today's episode. If you have any questions, make sure to leave them in the comment below and don't forget to like, share and subscribe.